Hello and welcome to another episode of Threat Update. I'm Kilian Engler, and joining me today is Kyle from our Incident Response Team. Kyle, how's it going?
Hey, not too bad. How about yourself?
Very good, thank you. So we have a pretty interesting topic for folks today. So over the last a couple months or year, we've done some research around different areas and different customer types, and we produced a report called our Data Risk Report. And the most recent one for 2021 focuses around healthcare. And healthcare organizations have unique sets of challenges. They deal with a lot of highly sensitive data, and with the pressures of COVID and over 2020, they've also been targets of attackers wanting to capitalize on some of that. So with some of the COVID phishing scams you saw earlier on, and also kind of, if you're in the research area as organizations were producing vaccines, again, that was another big target. So during this report, we really dove into about 58 customers, and we looked at about 3 billion files over a range of customer sizes, so breaking down between small, medium, and large organizations. And we covered a broad swath of different organization types, so hospitals, pharmaceutical companies, biotech companies, to get a really good sense of what our customers were seeing and what types of risks we were seeing in the industry. And so we had some pretty interesting findings. And Kyle, I wanted to pick your brain about some of this too, again, because you're on the ground with our customers all the time working through some of these things. So one of the big facts that I thought was a little bit interesting, and maybe the audience out there watching can comment if this jives with their experience or not, but across the board, on average, nearly 20% of files are open to every person in a healthcare organization. And I thought that was pretty shocking. Kyle, in terms of, working with your customers, do you find that shocking, or is that kind of jive with what you're seeing?
Yeah, it definitely is something that we've seen, and it's unfortunately a little more often than you expect. But no, definitely something that it's definitely an issue, and it continues to be so, regardless of the environment around us.
Yeah, that makes a lot of sense. In terms of, Kyle, threat detection and things like that. Now, some of this, or a lot of this, is sensitive data as well too, and that's something to take into account. So there's obviously organizations have all sorts of data, but healthcare in particular has a lot of highly regulated sensitive data. And in this report, we found that again, around average, 31,000 sensitive files are open to everybody. So being that would be a target for attackers and things like that, during investigations, do you find that organizations that are proactively trying to lock this down or working towards at least privileged model, do they fare better or worse, or do they come up more or less often during investigations that you've seen, Kyle?
Most definitely. I mean, the more mature models as far as like their positioning,
Right.
security wise. Yeah, I mean, with least privilege especially, it's quite effective. Unfortunately, though, even as operations expand, for example, you're going
Right.
to have these brief periods of possible revealing data that you didn't mean to.
Right.
It's just kind of the nature of it, and hopefully. If they are equipped with Varonis, they get that insight and they're able to remediate it quicker than maybe their counterparts. So yeah, I mean, definitely it remains an issue, and it's regardless of, like I said, of your posture, it's something that can definitely happen. So
Right. The other thing too, and then I'd really like to get your take on, is we've seen so many of these kind of more sophisticated malware and ransomware groups, especially coming out of 2021 and into this year. And as I mentioned, these types of organizations, healthcare, things like that, and even if we expand it a little bit further to kind of tangential, like insurance companies and things like that, and organizations with cyber insurance, tend to be bigger targets because there's a lot of money involved there. And again, this is maybe more insurance, but again, these are valuable intellectual property for pharmaceutical and biotech companies who are developing like vaccines and things like that.
right.
In terms of kind of the flow and the process, if we'll talk about a ransomware attack, what I guess kind of advice would you give to these organizations? So of course, if they got locked from ransomware, that would be kind of terrible. But how would you kind of recommend going about maybe walking back the detection, trying to catch it sooner in the organization? Are there any kind of tips or places that you would look or advise people to analyze to help kind of catch this before it gets to the the end state of?
Sure. Yeah, so I mean, like first and foremost, there's an entry point at some point, and
Sure.
whether maybe surprisingly or not, it's not often going to be a super complex vulnerability
Sure.
exploit. It's always starts with a lot of times starts with the people. So a good stringent training program,
Yeah.
emphasizing the risks and having those email headers, whatever it takes,
Mhm.
and then once you're in that, once that's taken care of, again, with Varonis, you're monitoring those file stores,
Right.
looking for that behavioral changes. So those can be great indicators of possible compromise and possibly upcoming, release or deployment rather of a ransomware variant. So,
Sure.
those, as well as having a good data recovery plan or disaster
Yeah.
recovery plan, excuse me. Again, yes, very important. And unfortunately, it's something that we've seen. Data recovery or disaster recovery plan that's coming in, at the time it's occurring, and it's
Right.
not when you want to be planning that. So yeah,
Right.
having those ahead of time and being prepared is definitely steps you can take.
How does the extortion factor of this? We've seen a lot of these organizations. So like the Revil or Reevil ransomware group talked a lot about this. How does that extortion kind of component to it affect some of that plan? And you talked about some of the backup and the recovery and detecting the ransomware as quickly as possible. What are some of the things that you'd look for to maybe detect before the data leaves your organization if somebody gets compromised? Are there places you'd recommend looking or data sets or platforms to monitor?
I mean, definitely. So your question is which stores to look at more?
Well, more along the lines of we know that extortion is part of the playbook now. Again, trying to detect it sooner than later. But what are some kind of key takeaways? Do we want to be monitoring obviously the data to detect it first? But are there any kind of surefire signs that there could be an indicator that maybe somebody's in there trying to exfiltrate data? And how would we kind of
Yeah, I
spot
mean,
that?
definitely access to poor reputation websites.
Right. Yeah.
Just really hhy level. And then of course keeping an eye on like your web proxy.
Sure.
Keeping an eye on what's going out as well as coming in, especially with the work from home environment. Yeah, so definitely keeping
Right.
an eye on that. Monitoring that proactively is definitely something you can do. Just to be on the watch, whether that indicates ransomware or other malware. Definitely good
Sure.
to keep an eye on.
Yeah, that makes a ton of sense. And again, I think maybe the key takeaway, and Kyle, keep me honest here, is just the sooner that we can detect potential signs of this, especially again in healthcare organizations that are facing so many challenges, again, both dealing with sensitive data and trying to keep us and provide healthcare for us and keep us safe in these kind of crazy times. And as we're kind of working on the vaccine and all these other things, there's a real chance, that disruption to this organization, to healthcare, could have some really just terrible results. And we've seen that again with some
Sure.
of the ransomware in hospitals and things like that. So any ways that we can help kind of move that the detection forward, I think would be really valuable. So thank you for
Absolutely.
sharing those insights. I
Of
really
course.
appreciate it. I think, and hopefully the audience will find that interesting too. If anybody out there is watching wants to read the full report, I did put a link to it. It's a PDF in the description below. It's really kind of revealing the types of information and kind of the breakdown. We go into a lot more detail on the stats about the types of data and where we're seeing it and how it differs between small, medium, and large organizations. So really fascinating read if you're in healthcare or just want some insight as a security practitioner about how kind of healthcare stacks up. And of course, if you read it and you have comments, you say, hey, we're doing better, we're doing worse, we'd love to hear that. Leave those comments down below. We'd love to hear from our audience. And if you found this content interesting and enjoyable, please consider subscribing to the channel if you're not already, or throw us a like. We really do appreciate that. So once again, thank you so much all for watching. Kyle, thank you for taking time out
course.
to join and enlighten us. And we'll look